As each and every person transitions into this room, I would like to take this time to reintroduce myself as your moderator, Imani Robertson, a third-year student at Howard University School of Law. I have the distinct pleasure and honor of introducing our keynote speaker. Olajumoke Obayanju is the director of the National Racial Equity Initiative for Social Justice at the Congressional Black Caucus Foundation. She oversees and manages the NREI to maximize its visibility and sustainability, ensures program objectives and initiatives, and focuses on advancing racial equity, human rights, education, and economic development opportunities for the African American community. Ms. Obayanju is a skilled strategist, facilitator, educator, and lawyer. And that is why I am so ecstatic to have her here with us today. I will now allow her to speak with us, and I hope that you ask questions, engage in the chat, and we'll be sure to address them.
Thank you. Thank you very much. Good afternoon. On behalf of the Congressional Black Caucus Foundation, I'd like to extend my gratitude to the Howard University Louis Stokes Health Sciences Library and the Vernon E. Jordan Jr. Law Library for the invitation to speak at today's symposium. Thank you to Dean Holly Walker for those welcome remarks and Imani Robertson for the introduction. Now, while I am a graduate of the George Washington University Law School, I am especially grateful for this invitation as a proud Howard University alumna. So thank you very much for the opportunity to speak today. I am going to take this moment to share my screen and we will go ahead and get started. I will be speaking on the topic, we've got work ahead. We've got work ahead. On March 25th, 1966, in a Chicago press conference, before his speech at the second convention of the Medical Committee for Human Rights, Dr. Martin Luther King Jr. said, "We are concerned about the constant use of federal funds to support this most notorious expression of segregation. Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death. I see no alternative to direct action and creative nonviolence to raise the conscience of the nation." 10 years prior to that speech, the Brown versus Board of Education decision became the groundwork for dismantling many of the formal systems of racial segregation we saw across the nation. Brown versus Board, it was used pertaining to public schooling and in housing, but one of the most long-term and perhaps least noticed areas of racial segregation, even after Brown versus Board, has been healthcare. During that time across the nation, African Americans were commonly denied access to care in hospital rooms, and this racial discrimination violated the Civil Rights Act of 1964. It violated the Supreme Court ruling striking down the sanction of separate but equal healthcare facilities in the Hill-Burton Act, and the 1965 Medicaid and Medicare legislation that would channel federal money to healthcare providers for patient care. And even then, Dr. King's attention to poverty and racism and housing and education, what we call the social determinants of health, made it clear the impact of health disparities. And while this speech referencing the racial segregation within hospitals was delivered 5 decades ago, health disparities still exist. And the pervasive emblem of racism continue to permeate the health sector, from access to quality of care to exposure. So in my time today, I'd love to talk about really how we define disparities in the health context. I'd like to share a little bit more about my work at the foundation, the work our National Racial Equity Initiative for Social Justice has accomplished, and our efforts to dismantle systems of racial inequity in the underserved communities, and the fight for truth and justice. As the inaugural director of the National Racial Equity Initiative, I am tasked with leading CBCF's new program that really focuses on advancing racial equity, human rights, education, and economic development opportunities for the African American community. Now, to provide some context for the content that I will discuss this afternoon, let me begin by sharing a little bit about my background. Imani mentioned I am a strategist, a facilitator, an educator, and a lawyer, and I've spent the last decade working in the education and the criminal justice advocacy sectors. I am unapologetically Black. I am especially passionate about racial justice. I am passionate about reforming our juvenile legal system, and I am passionate about educational equity. I've worked as a former middle school teacher. I've worked in the direct legal services spaces. I've served as a judicial law clerk in the District of Columbia, and as a racial justice and juvenile defense fellow at the Georgetown Juvenile Justice Clinic and Initiative, where I worked on policy reform for DC youth. I developed racial justice resources and trainings to support juvenile defenders nationally, and I created materials on strategies to identify and correct racial bias. Now, what's particularly of interest is that while I have never dedicated my practice or studies to health equity, and by no means am I a health expert, the intersectionality and the overlap of these issues are palpable. Even as a middle school teacher, as I observed the issues that my students faced in the classrooms, I began to discover that these issues are inextricably linked and connected to health disparities. I saw the same as a law clerk when I observed the parties that appeared before my judge in criminal court, that these issues are linked. So today you will hear reflections from leading experts, leading health experts on the symposium topic, challenges and legal implications of misinformation in health disparities and health policies. Before diving into the misinformation, I think what's important is for us to really understand and talk about disparities. Dr. Leonard Agede says, when we think of health disparities, one definition is from a research method view. The differences in the incidence, prevalence, mortality, and burden of diseases and other adverse conditions that exist among specific population groups in the United States. Now, another way to consider and think about disparities, which is largely how we view it in a legal lens, in the legal context, is the racial and ethnic differences in the quality of healthcare that are not due to access-related factors or clinical needs, preferences, and appropriateness of intervention. So, as I said, it's important to understand how we frame disparities, recognizing what they are and recognizing what they are not. So what I want to do next is reinforce that what we are seeing today, as many know, is not new, but systemic and structural. Our history has created this construct of health disparities, and we saw these disparities in the lexicon of Negro diseases, when the physician Samuel Cartwright, in an attempt to scientifically prove that Blacks were inferior to whites, he invented the condition drapetomania, which was a mental disorder akin to madness that apparently caused slaves to run away. So instead of viewing Black people's rebellion and fight for freedom as earnest, Cartwright manipulated science and statistics and diagnostic categories to support slavery and limit Black mobility and eliminate power sharing. We also saw these disparities in medical school education. We saw it in how racial disparities were taught in medical school, or should I say how they were not taught. The 1985 Heckler Report was the first acknowledgement of the higher burden of death and illness suffered by Blacks and other minority populations in the United States. That Heckler report was released in 1985. That was just 36 years ago. We also saw the disparities in the creation of Black hospitals and the poor, which created a space. So it did create a space for African Americans to receive healthcare. But what it also did was it moved healthcare services from exclusion to segregation, perpetuating the devaluation of African American lives. Because much like other sectors, the law, housing, education, segregation creates a system that prioritizes and places better resources and opportunities to another. We saw these disparities in the segregation of the American Medical Association and the more than 100 years that the American Medical Association actively reinforced or passively accepted racial inequalities and the exclusion of African American physicians and doctors. And lastly, we saw these disparities in the unethical experimentation on African Americans. Most commonly known is the 1932 Tuskegee experiment that was justified by researchers due to their fundamentally flawed scientific understandings of race, that Black people were extremely prone to sexually transmitted infections. These unconsented experiments, I argue, has formed a legacy of distrust by African Americans because of a system that treated them as guinea pigs. The Tuskegee experiment and many other experimentation on African Americans that have gone unrecorded is why mistrust remains an important barrier to research participation and treatment among African Americans. So with the prevalence of racist health practices baked into history, there's absolutely no shock with what we are experiencing in 2021. And despite all sides of health policy debates acknowledging the existence of these disparities, a consensus of the significant impact that it has made on Black and Brown communities is yet to be reached. Understandably, we talk about the magnitude of disparities that exist within the criminal justice system and education, but I argue that it's time to shed light and focus on health equity. Perhaps it's because of the little size of evidence of these health disparities, but it is time to shed light and focus on health equity. In the wake of the COVID-19 crisis, the increase of misinformation surrounding health disparities is undeniable. Its importance in shaping the larger narrative of race in America is inescapable, and the exponential effect that health disparities have on our undeserved populations is evident. There is an urgency for truth and for justice. A year ago, the video of George Floyd's murder spread across the nation, prompting protests in big cities and small cities over the reliving of yet another African American killed by police. Months before, it was Breonna Taylor. In 2018, it was Stephon Clark. And 7 years ago, it was Michael Brown, with countless more names in between. A year ago, George Floyd's murder exemplified the structural barriers and systemic racism that continue to pervade our societal constructs, from the criminal legal system and the court system to healthcare and education systems. But his death also inspired and more appropriately ignited a force of political, financial, and grassroots mobilization around social justice and racial equity work. So in 2020, the Congressional Black Caucus Foundation pledged to bolster its work in advancing racial justice by launching the National Racial Equity Initiative for Social Justice, which I will likely refer to as NREI. So I want to tell you a little bit about the Congressional Black Caucus Foundation. It is a nonpartisan public policy research and educational institute. The foundation's mission is to advance the global Black community by developing leaders, educating the public, and informing policy. And though CBCF's work for years has always been centered around the advancement of the global Black community, we recognized last year after the murder of George Floyd, and really the historically unleveled playing field for minorities, that there was more work that we could do. So let me tell you a little bit about the National Racial Equity Initiative. The NREI's mission is to combat systemic injustice and advance racial equity, human rights, education, and economic development opportunities for the Black community. It is housed in our Center for Policy Analysis and Research, and it takes an evidence-based approach to inform sound policies that reduce racial disparities caused by racism and discrimination. The National Racial Equity Initiative also provides solution-driven and proactive policies and practices that produce equitable access, opportunities, treatment, and outcome for African Americans. So what exactly makes us different? I tell people, as someone who's been working in the racial justice space, I give credit and honor for the work of the dozens of racial justice organizations who have been doing this work for years. But what makes us different is really our framework. Our framework supports CBCF's organizational mission of developing leaders, informing policy, and educating the public. So we have 4 goals. Our first goal is creating a pipeline to place social justice policy fellows in the United States Congress and the Center for Policy Analysis and Research for 12 months. Our second goal is advancing policy. We want to serve as a centralized data and research hub on social justice issues that advance racial equity and human rights work. Our third goal is empowering action-driven change. We have a plan to create a task force of social justice ambassadors. And our last goal is removing financial barriers to award social justice scholarships to students attending historically Black colleges and universities. Now, over the next couple of minutes, I want to spend some time discussing each of our components and our hopes as we move ahead. As I shared earlier, the NREI just hit its first year, and the initiative was successfully rolled out in September of 2020 with the welcoming of our 3 inaugural John R. Lewis Social Justice Fellows. Our fellowship program is designed to give young Black professionals the opportunity to work in Congress and the foundation to address the leading social justice and racial equity issues that affect our community. Now, in honor of John R. Lewis, there is a quote of his that I really love, and it's in his book, Across the Bridge, Life Lessons and a Vision for Change. The late John Lewis said, "Nothing can stop the power of a committed and determined people to make a difference in our society." Why? Because human beings are the most dynamic link to the divine on this planet. So in his memory, NREI aspires to develop a robust social justice fellowship pipeline to really increase our national reach, but also propel the social justice work of our congressional members and the foundation. To date, we have welcomed 10 social justice fellows who come in with varied areas of experience and expertise, from gender-based violence to higher education to criminal justice reform. Now, I must note that CBCF has had a congressional fellowship program for years. It was officially launched in 1976, nearly 50 years ago, to address the disparities in African-American employment on Capitol Hill. However, our social justice fellowship program specifically empowers young Black professionals with the training and the resources and access to address social justice and racial equity issues. And it also raises the level of social justice leaders committed to advancing equity across the country in different policy sectors. I hope by now I have attracted the interest of some of our attendees to consider applying for our September 2022 cohort of fellows. And if I haven't, let me add this. During the 12-month fellowship program, our fellows gain invaluable legislative experience as they engage in the development of policy initiatives. They attend briefings, observe committee hearings, conduct research, they write speeches, and develop rapport with key leaders across the nation. They also have an opportunity on the foundation side to conduct policy analysis, research and writing, data collection, and also organize a social justice forum or brain trust for our annual legislative conference and the NREI Social Justice Summit, while also receiving regular mentorship, professional and personal skill development opportunities. It is indeed an impressive program that will optimistically propel and launch our next generation of change agents. Before transitioning to our scholarships, I'd be remiss if I didn't acknowledge that we also have our Louis Stokes Urban Health Policy Fellowship Program, honoring the former Congressman Louis B. Stokes, one of the original founders of the Congressional Black Caucus and the Congressional Black Caucus's Health Brain Trust. The primary goal of that particular fellowship program is to increase the pool of qualified minority health policy professionals committed to eliminating health disparities in the United States and abroad. So I'm going to move on to our scholarship program. For more than 3 decades, the CBCF, in partnership with CBC Spouses, has awarded scholarships to talented, deserving students. Each year, we award more than 300 scholarships to students that demonstrate leadership ability through exemplary community service and academic talent. Our scholarship program supports current or upcoming college students across a variety of disciplines. The NREI, Historically Black Colleges and Universities Social Justice Scholarships, were created last year to encourage and support the next generation of social justice leaders. Now, as a product of an HBCU, I recognize the unique experiences that our students encounter financially. These specific scholarships are intended to ameliorate the economic hardships, particularly experienced by HBCU students who are committed to social justice work, with the hopes of removing financial barriers and expanding future opportunities and access to success. I am pleased to formally announce that we received 219 applications for our HBCU scholarships, with more than 40 HBCUs represented, and we recently awarded $450,000 to 45 undergraduate and graduate HBCU students committed to social justice work. And just so that you know that I am extremely proud to be an HBCU alum and that my love for HBCUs run deep, let me use this opportunity to highlight and plug one of my pieces in the 2021 Black Women's Roundtable report, titled 150 Years Later, The Radical Success of HBCUs. So if you have some downtime and you also love HBCUs as much as I do, please take an opportunity to read that piece. Now let me move into our last 2 components. As part of our initiative, we will launch a task force of social justice ambassadors, a cohort of individuals committed to challenging racial injustice. Using their individual platforms, they will work in collaboration with the NREI, sharing best practices and raising awareness through media and mass movements for change, with attention to youth activism, community organizing, and grassroots mobilization. More specifically, the task force will push policy that compels action by lawmakers to end systemic inequity and racism and advances community-based solutions. They will disseminate research and information to the public, expanding legislative knowledge and promoting civic engagement. They will partner with NREI leadership to develop programming, and they will utilize their power and platform to equip young leaders and community members and serve as champions for change. With our task force, we envision an interdisciplinary group of national ambassadors, including experts, think tank partners, influencers, community activists, and private sector change agents. I certainly encourage you to look out for more information about our task force, which will launch in 2022. And lastly, our policy research. The NREI research informs public policy that advances social justice reform through the production of reports, policy briefings, and strategic engagement with the Congressional Black Caucus. Our 4 priority areas are criminal justice, education, health equity, and economic opportunity. The NREI research is housed under our Center for Policy Analysis and Research. And our research also implements the importance of data with the purpose to break down barriers to offer a more efficient methodology to help Black communities end racial bias. Our research introduces results produced by the new generation of change agents, our fellows, who have come of age during the technology-focused eras in this country. Our research also offers front-facing engagement through community narratives to educate African Americans about the lack of record coordination and the need of standardization of critical data. Our research provides opportunities to seek community-level dialogue and solutions to meet people where they are and serve them as they want and need to be informed and educated. Our research also leverages relationships with strategic partners to collaborate on intersectional issues around the above topics. Some of our proposed and ongoing research is centered around the school to prison pipeline, the criminalization of our Black youth, the Ban the Box movement and workplace discrimination, Black wealth creation, methods for preventing racist practices in sentencing and incarceration, Black maternal health disparities, racial bias in the court system, and police brutality and accountability. Through our NREI program components, the fellowships, the scholarships, the task force, and our research, our goal is to ensure that we are first understanding our communities, to build collective power and involve the voices of those who are affected. We want to critically inform policy solutions that are rooted in community analysis and critical data. We have already placed fellows in the congressional member offices who are making significant strides in advocating for social justice policy. We have already eliminated barriers for dozens of students who are committed to becoming our next social justice leaders. We have already began producing research and policy briefs to educate the public, and we are currently planning our first ever National Racial Equity Initiative Summit to tackle issues from bias within the criminal justice system to trauma-informed policy making. And to be frank, we've got a lot of work ahead in this fight for racial justice in the criminal legal system, in education, in our health spaces, and economic spaces. But what I say is that it involves the united effort of interdisciplinary practitioners, experts, and leaders. It involves you. It involves the middle school teacher in the classroom. It involves the law professor discussing legislation, the C-suite VP of a company, the blog writer, the news journalist, the residency student in medical school. It involves us all. We all have a part to play. We've all got work ahead in our respective fields, but I also believe that now more than ever, we have a generation of leaders with the fervor and resolve to tackle that great work. I am so thankful for the opportunity to speak today, and I wish you all an amazing rest of your symposium. Thank you for listening.
Ms. Obayanju, I cannot thank you enough for such a thorough reflection of the work that NREI is doing, and just not only in the community, but affording opportunities for students to participate. And I have to tell you, your law school classmates were absolutely correct when they voted you most generous with your time, compassion, and vitality to aid others in their intellectual and spiritual growth. We have a few questions. I have a few of my own. And I just want to take this time to get your opinions and your thoughts. One audience member wanted to ask, which NREI initiative are you personally most excited about? And how does that initiative most address any of the medical disparities that you spoke about today?
Thank you for that question. I am probably most excited about our fellowship program because what we're doing is we're creating a pipeline of future John Lewises, right? And so we are giving who would ordinarily be an unrepresented group of individuals access to work on Capitol Hill. When you go to Capitol Hill and when you look at our members of Congress and even our staffers, our legislative staffers, they do not always reflect our nation. And so we are expanding opportunities for young Black professionals to be able to work on the Hill. So I'm most particularly excited about that initiative and really what it means moving forward. I am excited that in the next 5 years, we will have 40 John R. Lewis Social Justice Fellows who perhaps might be on the Hill, who might be in the C-suite, who might be judges, who might be doing policy work, and who are just in different policy sectors. And to answer the second part of that question about how they are addressing the medical disparities that I spoke of today, each of our fellows come in with a different level of expertise. And so we've got a technology fellow, we've got a health fellow, we've got another fellow who is focusing on criminal reform, criminal justice reform. And so some of our fellows that are currently health fellows are placed in on the Hill, and they are working specifically on those issues that we have discussed. They are working in their spaces and their expertise, and hopefully they are propelling and moving forward the policies that we are trying to move forward in our country or eradicate in our country. So thank you for that question.
No, that is incredible, and it definitely speaks to the involvement that the community plays in moving forward the initiatives and the research. I think that's absolutely phenomenal. Along those lines of figuring out how the research affects health equity specifically, one member of the audience asked, how does food justice play into the health equity research?
I love that question, probably because we don't talk about food justice enough. And so we have been doing research, expanding the work of food deserts that exist. And so again, when I talked about this idea of intersectionality earlier and how everything is connected, when we think about food deserts, we think about how that impacts education and how it impacts our young people and how it impacts crime. And so we are focusing on not only food deserts in our urban cities and our spaces, but we're also focusing on the intersectional issues and how each affect each other. And I don't think I mentioned this, but I said our 4 priority areas are criminal justice, education, economic opportunity, and health equity. But what I also want to enforce is that a lot of times we think of these issues in silos, but what we're doing at the NREI is ensuring that when we talk about criminal justice, how does that affect youth? And how does that affect youth in education? When we talk about criminal justice, how does that affect economic opportunities when we think about reentry, right? And so we like to think about these issues, and I charge people to think about these issues intersectionally and understanding that they are all connected.
Well, I think not only charging people to think about how they're interconnected, but really taking the time to think about the people who are doing the work, such as yourself. Along those lines, I would like to ask, what are 3 things you would say to someone who is really interested in getting involved with the work that you're doing at the NREI, aside from the scholarships, right? You discussed how your career, you didn't know you'd be where you are today when you first started. So could you give a few pointers about yourself and how to pursue such a career?
I can. Imani, that's a great question. And I'm not going to give you an easy answer. And I say that because law school's weird, right? We come in and some people know that they want to practice IP law. Some people come in and they know that they want to be a criminal defense attorney. And then some people like me come in and say, oh my God, I love racial justice work. I want to do educational equity work. I want to focus on our youth. And there's really no path. Except pursuing your interest. And so I made sure when I was in law school that I interned at Neighborhood Legal Services. I interned at Bread for the City. I interned at Department of Education. I was able to dive into all of my interests and not necessarily follow a path. I think that's the tricky part. You think you have to follow a path, but I charge folks to do what it is that you're interested in, even if it doesn't make sense to others. Because it is a part of your narrative and it is a part of your story and it'll all make sense. And then in terms of how people can get involved in the work that I do. So I did mention our scholarships and our fellowship programs. I tell people to connect on LinkedIn and figure out if there is research that you can do, or if there's some sort of collaboration that you can do with someone who is working in the racial justice space. You can also write. I tell people all the time, you do not have to be affiliated with an organization or a company to write. You can do your own research and expose the work that you are excited about. And so that could be, again, that could be education, that could be tech equity, that could be health equity, that could be economic opportunity. It could be anything, but you can write on your own. And another thing that I would also add is to never stop learning. Because you never know what opportunities will present themselves. And so you can always continue to sharpen your expertise and sharpen the education that you have by just learning, by just reading, by researching, by participating in symposiums similar to this.
I mean, I am actually super grateful for that answer, because you really tapped on the notion that sometimes you don't know, and really doors will open when you explore. I really want to revisit the idea of participation, right? We discussed the several opportunities that the NREI offers for scholars, and we talked about how people who are on this symposium can be involved. But I'd like to talk about the other side of the work that is being done with these initiatives and this research. How do you engage the community to be involved when, honestly, sometimes that is seen as a privilege, right? The time to be involved with some of these issues. How do we work to engage our communities, regardless of where we're at, to engage with some of the things that are actually affecting them?
It's tough. I think that the huge piece of NREI is we are trying to meet people where they're at, right? And so next year, we are planning community conversations. We are traveling to different cities. We are teaming up with community organizers to bring people the information where they are at. I think, and I love that you use the word privilege, because often it is a privilege. There are, if I name some legislation right now, there might be a handful of people who are familiar because they are in the space. But your lay person, your average person that you bump into at Target, if you start talking about legislation, they might not be familiar. And that's not a fault of theirs. It's just the fact that there is no access. And so I say that with the work that we're doing, we have to figure out how are we pulling people along, and we're pulling people along by meeting them where they're at. A part of our mission at CBCF is informing the public. And so we've been really trying to figure out, how do we make sure that we inform the public? Number one is making it easy and accessible. Number two is making it clear. As lawyers, we get so stuck in this legalese and we use these big words, and I'm probably sure I used big words today, but we use these big words, and a lot of times the issues are simpler and we break it down. The third thing that I want to add is the establishment of our ambassadors, our NREI social justice ambassadors, is actually literally created to empower action-driven change. So we're trying to figure out, how do we use influencers, and how do we use community activists, and how do we use private sector change agents to move into these communities and show them the work that we're doing. So it's by meeting people where they're at. So it's tough, but I think that what we want to do is try to eliminate barriers and try to meet people, again, as I said, where they're at.
I am learning so much as I'm a part of the conversation. I think, the way that we figure it all out, like you said, is just stay informed and try to help spread the news and informing the public. And I am just so grateful for the work that NREI is doing, especially having you as the inaugural director. I am just completely just in awe of all the great things that are happening. So I just want to thank each and every attendee for joining and hearing from our keynote speaker. And at this time, I just want to say again that we have so much more in store. There's a lot of information that you all can look up, but please feel free to reach out to Ms. Obayanju. You really just helped us today with a lot of information. At this time, I want everyone to help me in thanking our keynote speaker again. And I want to make clear that at this time, you can leave this session and go into the symposium lobby. And from there, you'll be able to join the next session where we will have a panelist. Again, thank you so much for this information, for this open and transparent conversation, and really making sure that we're informed to play our part and be a part of the conversation.
Thank you very much.
Thank you.